It means a lot to me to be selected as a Castle Connolly Top Doctor. I've always looked at this ranking system as a ranking system that I would like to be a part of because I know that it's legitimate and well respected, and I know that this ranking is done by my peers, which is really important to me. So I'm honored and flattered to be a Castle Connolly Top Doctor. The fact that I'm nominated by my peers is probably the most important thing to me because those are the people that really know what good medicine is and what it means to be a good doctor and to take care of patients well. I decided initially to become a physician partially because it ran in my family, but I think as I was sort of exploring other things in college, I sort of realized that it was a bit of a calling for me and it just kind of fit naturally with my skills. I was also always interested in art and sort of had an aesthetic sensibility, and so I chose dermatology because of the aesthetic nature of it and the artistic attributes of it. I think different demographics in medicine do sort of need different approaches, and of course there's so many individuals within those different demographic groups, but I think that we do need to, I think physicians do need to have cultural awareness of a certain population in order to treat them, in the best possible way. I think we're lucky in New York that there's so many resources for LGBT patients. And I think within dermatology, having an awareness of cultural issues within that community and also aesthetic issues within that community in terms of transness and non-binariness is helpful, especially for an aesthetic dermatologist. I think diversity and inclusion is really important in healthcare because patients typically have better outcomes when their physicians are part of a similar community. And I think eventually we may get to a point where that's not an important issue, but right now we know that data shows that patients have better outcomes when they are seen by people who understand their community and their ethnic and cultural background. So I think it's really important that the community of physicians represents the greater community. So that means having as many LGBT physicians as there are in the community at large. I think practices can show their support by looking at their questionnaires, their intake questionnaires, and making sure that they are gender and non-binary inclusive, that the questions are not heteronormative or gendered in any way, and then they can show support for the community by posting on Pride or other sort of small gestures that people of the LGBT community recognize and appreciate. I have not used AI, but I see AI coming into dermatology in a few ways. One is with full body screenings. I think we're gonna get better at having an image-based follow-up method where AI can look at somebody's body and look for any changing lesions. I think AI also has a role to play in sort of aesthetic dermatology in terms of illustrating to somebody maybe what they can expect from a before and after, which we're not so good at yet. And so I think that's two places where AI can help in dermatology.